When we hear the term plastic surgery, I bet most of us immediately picture the glitz and glamour of cosmetic enhancements, right? But today, we're going to uncover the fascinating, multi-layered reality of this field. As we'll see in this explainer, it's actually an incredibly vast medical discipline that fundamentally restores crucial bodily functions and, quite literally, saves lives and limbs. It's wild. So let's challenge that common Hollywood stereotype for a second and ask ourselves, what does this medical field actually encompass? I mean, is it just about smoothing wrinkles and changing nose shapes? Or is there an entirely different, highly complex side to this specialty that deals with severe trauma, chronic disease, and rebuilding human anatomy literally from scratch? Here is our roadmap for today. First, we'll look at the complete surgery center. Second, aesthetics and body contouring. Third, rebuilding, burns and faces. And fourth, advanced trauma and limb care. Let's get right into it. Section 1. The complete surgery center anchoring the practice. To really grasp the true breadth of this specialty, we're looking at the exact practice framework of Dr. G. Amar Raghu Narayan. He's a consultant plastic, cosmetic, and reconstructive surgeon. Examining a premium high-end clinic like his gives us the absolute perfect lens to see advanced reconstructive, microsurgical, and aesthetic solutions all operating under one incredibly specialized roof. Now, what's really striking here is the sheer contrast between elective aesthetic solutions and highly complex restorative ones. On one hand, we've got procedures aimed at enhancing form, things like facelifts and rhinoplasty. But right next door, handled by the exact same surgical experts, are procedures like total jaw reconstruction. It really highlights the dual nature of the specialty, doesn't it? Enhancing the normal while painstakingly restoring the severely damaged. Moving on to Section 2, aesthetics and body contouring, enhancing form. These are the popular cosmetic procedures aimed at enhancing natural features, and you've probably heard of most of them. But it's funny how clinical the medical terms actually are. Like blepharoplasty, that's just the medical term for eyelid surgery. Abdominoplasty is what we all commonly call a tummy tuck. This covers everything from structural changes like rhinoplasty to surface-level dermatological enhancements like Botox, chemical peels, and scar resurfacing. It also involves techniques like fat transfer, which is literally moving tissue from one part of the body to another to get a desired contour, often paired with liposuction. Wrapping up the aesthetic side, we have body contouring procedures. These focus on meticulously adjusting body proportions. We're talking breast augmentation and reduction, as well as gynecomastia surgery for men. But it also includes large-scale skin and tissue management, like arm lifts and thigh lifts. The key takeaway here is that even in these elective cosmetic arenas, the surgeon needs a profound, almost architectural understanding of anatomical balance and tissue dynamics. All right, Section 3, rebuilding, burns and faces, restoring structure. So a massive part of this field is how specialists manage severe trauma, like burns. And let me tell you, this isn't just about putting on a bandage. It requires intense, acute, and chronic care over really long periods. Take a look at the term burn contracture release. When severe burns heal, the skin can tighten and contract so much that it actually restricts a patient's movement. Plastic surgeons have to literally step in and surgically release that tension. They also manage highly complex tissue responses like keloid and hypertrophic scars using revision surgery, laser treatments, and even advanced skin substitutes to give these patients a chance at a normal life. This part absolutely blows my mind because it illustrates the sheer architectural complexity of facial reconstruction. When we say mandible and maxillar reconstruction, we are talking about completely rebuilding a patient's lower and upper jaw from scratch. These surgeons are meticulously reconstructing lips, tongues, eyelids, noses, cheeks, and scalps, all the way down through the chest wall. It's like putting together a staggeringly complex human puzzle. Which brings us to Section 4, advanced trauma and limb care, saving life and limb. To truly understand this next level of trauma care, we have to decode a very clinical term, microvascular-free tissue transfer. This is the foundational technique that allows surgeons to repair massive physical defects. Imagine taking a piece of living tissue, or even a section of bone, entirely detaching it from one area of the body and moving it to a damaged limb. To keep that tissue alive, the surgeon actually sits at a microscope and individually stitches together tiny, thread-like blood vessels to restore blood flow. The level of precision required is just unfathomable. The intense reality of these procedures is astounding. We're looking at lower and upper limb trauma reconstruction. Words like revascularization and replantation surgeries might sound dry, but they are literally the last line of defense preventing an amputation after a severe accident. By utilizing microvascular bone transfers and skin grafting, these surgeons aren't just making a limb look whole again. They are ensuring blood flows and muscles actually work so the patient can keep their arm or leg. Now, this precision is heavily applied in hand surgery, which is a highly specialized subset of the field. Think about our hands for a second. They are incredibly dense webs of nerves, blood vessels, and tendons. When they get damaged, whether it's from carpal tunnel or an injury requiring full-blown tendon transfers, it's the plastic and reconstructive surgeon who uses those microvascular procedures to navigate that delicate web. Their goal? To give patients their mobility and independence right back. Finally, and you might not expect this, plastic surgery incredibly intersects with chronic disease management. Diabetic foot care is a major part of this center's practice. Diabetes can severely compromise blood flow and healing, which leads to devastating wounds. These surgeons step in with wound debridement, negative pressure wound therapy, and complex flap coverage and skin grafting to salvage diabetic feet. And, if an amputation is ultimately unavoidable, they provide the crucial surgical foundation and prosthetic guidance needed for the patient's recovery. It's a vital limb-saving medical service. So, having journeyed from surface-level aesthetics all the way down to the depths of microvascular replantation and diabetic foot salvage, it's pretty clear, right? What we so often dismiss as purely cosmetic is actually a profound, highly advanced medical specialty. It's a field dedicated to rebuilding the human body, restoring critical function, and giving people their lives back after unthinkable trauma. It truly is so much more than meets the eye. So the next time you hear the words plastic surgeon, how will you define it?